Hi, I'm Danielle Heberly. I'm the Manager of Clinical Services at Midmark. I'm also a certified veterinary technician and honorary veterinary technician specialist in dentistry. In this video, we will focus on proper technique and maintenance of your dental delivery unit handpieces. We'll explore clinical best practices that not only extend the life of your handpieces, but also support optimal performance in patient care. Whether you're a technician scaling and polishing teeth or a veterinarian performing oral surgery, using proper technique and following recommended maintenance protocols can impact your equipment and the delivery of quality, efficient patient care. Let's dive in to see how you can get the most out of your dental handpieces. We will highlight the high-speed handpiece and starter pack of burrs, the low-speed handpiece and starter pack of disposable prophy angles, and the piezo scaler and scaler tips. A starter pack of burrs is provided for use with the high-speed handpieces. It includes a football diamond burr and variety of cross-cut fissure and round carbide burrs. Carbide burrs are used for removing bone and sectioning teeth. They are intended for one-time use since they wear down quickly during procedures. This rapid wear can lead to users applying additional force to cut the tooth and exerting too much pressure on the turbine of the high-speed handpiece. Dispose of your carbide burrs after each procedure. It is far less expensive to replace carbide burrs than to replace the turbine in your handpiece. Diamond burrs are used for smoothing bone and can be cleaned, autoclaved, and reused. To avoid damage to the turbine, never run a high-speed handpiece without a burr. To properly seat a burr, insert it into the chuck until it stops. Center your finger on the button, press, then push the burr until it is fully seated in the chuck. Tug back on the burr to ensure it is properly seated. Proper technique is important when using the high-speed handpiece. The burr rotates at 400,000 RPMs, so a light touch and feathering motion are the most efficient and effective techniques. When sectioning a multi-rooted tooth with a cross-cut fissure burr, avoid dragging the burr down through the tooth. This puts excessive pressure on the turbine. When using a round burr to remove alveolar bone, it's best to skate the burr lightly across the bone. Minimal pressure is needed since the burr's rotation handles most of the work. To maintain your high-speed handpiece, use the handpiece conditioning spray. Bone particles and graphite from the burr can get into the gears of the turbine. It's important to use the conditioning spray to flush out that debris after each procedure for optimal performance. Now we will review the low-speed handpiece. One pack of disposable prophy angles is provided for use with your low-speed handpiece. These prophy angles oscillate rather than spin. This generates less heat and less splatter and will not catch whiskers and muzzle hair. All prophy angles are a universal fit. To install a prophy angle on the low-speed handpiece, turn the locking ring to unlock. Line up the notch of the prophy angle with the bump on the handpiece and then push down. Turn the locking ring to lock it in place. To properly use your low-speed handpiece, use a generous amount of prophy paste. Apply just enough pressure to flare the cup over the tooth. You can also flare the cup under the gum line. It is not necessary to spend too much time polishing each tooth. A few seconds on the surface areas are enough. To maintain your low-speed handpiece, use the conditioning spray daily. Your piezo scaler kit includes 3 scaler tips, scaler tip wrenches, and a tip wear guide. Each of the provided scaler tips serves a specific purpose, and using each tip correctly can extend its lifespan. The tips can be identified by the number etched at the base of each tip. The number 2 tip, also called the beaver tail tip, is used for removing heavy calculus. The flat end of this tip may be angled perpendicular to the tooth, making it the only tip oriented this way. All other tips should only be used on the lateral surfaces. The number 1 S tip is slim but strong, designed for both supra and subgingival scaling. The number 10 P is the perio tip, suitable for subgingival scaling and can be used in periodontal pockets up to 3 millimeters deep. The standard pocket depth for medium to large patients is 3 millimeters, while for toy breeds and feline patients, it is 1 millimeter. Anything greater than 3 millimeters is considered significant and will require additional treatment. Your dental delivery unit includes a helpful scaler tip wear guide to help you identify when it's time to replace your scaler tips. The guide is part of the maintenance label that is located under the silicone mat on the top of the dental delivery unit. Scaler tips wear down over time and lose efficiency. To measure a tip, remove it from the handpiece and place it on the tip wear guide diagram. If the tip falls at or below the red line, it's time to replace it. Scaler tip wrenches are included for the 3 scaler tips. These wrenches allow you to properly install and remove the scaling tips without over-tightening. Proper use of wrenches supports correct insertion and removal of the scaler tips. Keep the tips loaded in the wrenches and accessible on your work surface. This will make it easier to swap tips during procedures. Use the guide on the side of the wrench to insert the tip correctly. Screw the tip into the scaler until the gray center of the wrench no longer turns. When the wrench stops turning, apply additional force until the blue outer ring of the wrench continues to turn, fully seating the scaler tip into the handpiece. If you hear a high-pitched noise from your scaler handpiece, the scaler tip may not be fully seated. Use the scaler tip wrench to re-tighten. There is a color-coded dial on the front of your dental delivery system, and each scaler tip has a colored band at its base. These colors indicate the correct frequency range for scaling. The included tips have a blue band, indicating that scaling with these tips should be done within the blue frequency range for safer and more efficient operation. Next, we will review how to set up the scaler handpiece for proper water flow. Start by turning the water and power dial off. Press the foot pedal and adjust the water until it is a fast drip. Next, turn the power dial to the desired setting in the blue section. This should produce a nice halo of water spray. Adjust as needed. It is important to maintain proper water flow during use to avoid overheating of the scaler tip. Piezo tips function similarly to hand instruments but do not require force or pressure. The active area of each tip is located on the first 2 to 3 millimeters. Avoid using the point of the tip directly on the tooth. This can cause pain for the patient and damage the tooth. The most effective scaling occurs when using the sides of the tip, where the vibration is the strongest. The exception is the number 2 beaver tail tip, which should be positioned perpendicular to the tooth. Hold the scaler handpiece as you would a pen or pencil, keeping the tip angled 0 to 5 degrees off the tooth surface. If the angle exceeds 5 degrees, a high-pitched sound will indicate the need to adjust back to the correct range of 0 to 5 degrees. It is important to remember any part of the scaler tip not being cooled by water can quickly heat up. Do not operate the scaler without ensuring proper water flow. Never touch the scaler tip with your finger. As the scaler tips wear down, they become less efficient, which often leads to applying more pressure on the tooth. Worn tips do not cool effectively. Allowing the tips to overheat can cause thermal damage and significant pain to the patient. To avoid this, limit the time spent on each tooth and keep the scaler moving back and forth in a crosshatch pattern. Now that we've reviewed the handpieces on your Midmark mobile dental delivery system, let's discuss the importance of waterline maintenance. Biofilm can accumulate in the tubing of dental delivery systems when left untreated or improperly maintained. It is crucial to minimize bacterial levels for the safety of your patients and staff. Water treatment options include cartridges or tablets that purify the water flowing through the dental water lines. We do not recommend using bleach to flush the water lines as it can damage your equipment. If you experience technical issues or are interested in our periodic maintenance plan, contact Midmark Technical Support at 1-800-MIDMARK. Follow the prompts to Animal Health Dental Delivery. Have your serial number ready so a member of our technical services team can reference your account and help you with your concern. You can also reference the included Midmark Mobile Dental Delivery User Guide or go to midmark.com. The next step in practicing dentistry at the highest level in your clinic is whole team training. Midmark Academy offers over 100 hours of RACE-approved clinical training in dentistry and anesthesia. To learn more, visit midmarkacademy.com or email midmarkacademy@midmark.com.